MD Conference Live presents updates from the American College of Cardiology meeting in Orlando, Florida.
Dr. Ricker, thank you so much for joining us. The Jupiter trial looks like it's going to change clinical practice. Can you tell us some of the top findings that you presented today?
Well, fundamentally, Jupiter was arguing if half of all patients who suffer a heart attack and stroke have average, if not low levels of cholesterol, how can we better identify them and will therapy work? So we took patients with low levels of cholesterol, elevated levels of a marker of inflammation called high sensitivity CRP or HSCRP. Half got a statin drug, rosuvastatin, half got placebo, and the results are pretty terrific. A 44% reduction in the overall event rate, 55% reduction in heart attack, 50% reduction in stroke, 46% reduction in bypass surgery angioplasty, and a 20% reduction in all-cause mortality. So what we've learned is that we have a new way of finding out, is my patient at high risk, even if cholesterol is low? And more importantly, I now have an intervention that we can give that patient. So the top line really is, look, diet, exercise, and smoking cessation remain the most important interventions for all of our patients. But on top of that, for many of them, a statin therapy can really make a big difference in their lives.
Now, today you presented in a new analysis looking at that link between LDL and CRP. Could you explain that a little more in detail for us?
So the new data being presented at the American College of Cardiology meetings has to do with why was Jupiter so effective? And part of the answer is that yes, we gave a powerful statin and got the LDL down very low. But it turns out that at all levels of LDL reduction, it still mattered about where the CRP got down to. And what the data really show is that even if you get your LDL to a very aggressive level, like less than 70, if you got the CRP down less than 2, patients did extremely well. If the CRP went down even further to 1, almost an 80% reduction in events. So the data provide us very strong support for the idea that if you're going to initiate therapy, the level that you get for CRP is as important as the level you get for cholesterol, and both really determine what's the benefit for my patient. I think Jupiter has profound impact on how we think about prevention. The question we as physicians have to struggle with now is, look, if we're trying to prevent heart attack, prevent stroke, prevent cardiovascular death, we need to widen our thinking about why these drugs are effective and widen our thinking about who's at risk. I don't think we can rely any longer on simple Framingham scores or on simple LDL cholesterol. These remain very important, but there's more to this disease, and that's what this trial is all about.
And do you see new trials in your future, given that there seem to be new data or new analyses in the future?
Well, our own group is now asking the question, if lowering inflammation seems to matter, can we think about inflammation reduction drugs per se? But these will be off in the future.
So will there be more to hear from you at the ESC or AHA later this year?
There probably will be.
Thank you very much for your time.
It's my pleasure.